As the president and owner of Bayshore Home Health, I want to welcome you to our team. No matter where you are coming from, I know you will find this a great company to be part of. Bayshore is an organization that is full of heart. We have so many wonderful, caring employees across the country. Employees who are dedicated to making a difference in our clients' lives every visit, every time, and who really support each other. Bayshore is in the business of taking care of people. That's why we make sure that we take care of our people. We believe in treating our employees with respect and recognizing their contributions. And we like to think we offer a great working environment where employees are encouraged to learn and grow on the job and to achieve their career objectives, whatever they may be. We know that if we take good care of you, you will take good care of our clients. But don't just take my word for it.
There are a lot of reasons I like working for Bayshore Home Health. Respect is a big one. I feel that management respects and supports staff. When I told my manager that I wanted to become a special facilitator who helps with team building, she said yes right away because she could see that it was something that was important to me, and she always encourages me to build on my strengths. I have grown more here in the last 4 years than in any other job. I also feel that staff really listen to each other and respect each other's contributions. As a client service coordinator, I often send notes to employees just to thank them for taking such good care of our clients. Let's face it, when you feel respect, you give respect. When you feel heard, you take the time to hear others. It creates a snowball effect, and you can see it in the way our staff take care of our clients and how they build special relationships with them, like when they go to visit clients at the hospital on their own time. Bayshore is a progressive, compassionate, growing company that shows true concern for its clients and employees.
I feel proud to be part of Bayshore Home Health because my work is recognized and appreciated. The staff are very friendly. When I call in, they always ask me, "How's your day going, Jenny?" Then we share stories, but they never forget to thank me for what I do for my clients. This simple appreciation encourages me to do even more. Bayshore cares about its employees the same way it cares for its clients. I had a palliative client who was dying of cancer at 36 years old, my age. It was very hard to watch her 2 young children and her husband struggling. Right after she passed away, my supervisor called to see how I was doing and asked me if I needed counseling or time off. Bayshore really cared about how this had affected me. The company also gives me lots of opportunities to learn and grow. There are training sessions and workshops every month to help me gain more knowledge, refresh my skills, and learn new techniques. The more skills I have, the more variety of clients I get to work with. My job has given me confidence, and I enjoy making difference in people's lives. My supervisor even suggested that I go back to school to become a nurse. I feel like I have a great future at Bayshore.
A lot of people ask me why I got into this business. The truth is that I believe passionately that home is the place to be. People do so much better when they are cared for at home. They have more control over their lives. They can get up when they want, eat what they want, and follow their routines. They have a better quality of life. I think they are much happier. We once had a client who had ALS. She was in the intensive care unit at a hospital. Her doctors had told her she didn't have much time left. She wanted to spend her final days at her cottage, so we provided her home health care for her there. She ended up living 2 years instead of the 2 weeks her doctors had given her. It's stories like this one that bring me to work every day. I am so energized and excited about how our staff are making a difference in our clients' lives every visit, every time. Our nurses and caregivers just don't do what the care plan says. They do so much more. I heard a story recently about a personal support worker who was caring for a client who had been in a car accident. He had broken his collarbone and his leg, and he complained that his toes were always cold because they were sticking out of his cast. So our personal support worker went home and knitted a cap for his toes. I've heard stories of Bayshore Home Health employees going across floodwaters to see clients and phoning them over a dozen times just to make sure they're all right. That's because Bayshore staff care about making their clients' lives better.
Bayshore Home Health doesn't tell employees how to do their job. Instead, we are encouraged to do the best we can for our clients. Our management relies on us for our input and ideas, and they give us the flexibility to be creative in our jobs. I remember a situation we had up in Northern Ontario. One of our nurses was taking care of a client who had a bad wound, and she was trying to communicate with the case manager who was hours away. So she came up with the idea of taking digital photos of the wound so that the case manager could actually see the progress being made. The photos also helped the client see that he was getting better. Bayshore also believes in ensuring there is a good fit between our caregivers, our nurses, and our clients. The relationship is an important part of the client's healing. We had a First Nations client who needed home care, so we matched him up with a personal support worker who was also First Nations. She was wonderful with him. She really went above and beyond her duties, cooking wild meats for him and bringing in certain types of spices which he believed would help him get better. She even arranged for a spiritual leader from the community to come into his home and perform a healing ceremony. She made a real difference in his life. Bayshore is the best company I've ever worked for.
What I like about my job at Bayshore Home Health is that I don't feel rushed all the time, as if someone is waiting for me in the next room, like I did when I used to work at a nursing home. Here, I'm supported to take my time and provide the kind of quality care that's important to me. I feel like I can be present and really focus on each client's individual needs. And the benefit of developing this kind of care relationship with clients is that I can assess when things change for them. For instance, I have a client who is usually quite stoic and independent, but I noticed recently that she was tired and worn out, and that she seemed to need more companionship. So I spoke with her family about this, and they encouraged me to take more time with her. I like that. I've learned to work really hard at Bayshore because I know that people are counting on me. I try to give my best to the company and to my clients, and I've realized that I can make a huge difference just by paying attention. I feel like this is a good way to use my life.
As we deliver more than 5 million hours of care each year to over 40,000 Canadians, we need talented people just like you to help us continue to build our reputation as Canada's leader in home and community healthcare services. And you can count on us to support you in every way, including providing you with a supportive team environment, recognizing your contributions, and helping you reach your potential. Remember, the Bayshore difference is you.